arrive in the Eastern Cape. Thereafter, healthcare workers from both the public and private sectors will be the first to receive the life-saving jab as part of phase 1 of the mass rollout of the vaccine. For an update, let's now cross live to our colleague, Lerato Fekisi. A very good morning to Lerato, the Eastern Cape, to begin rolling out the vaccine tomorrow. What are people saying on the ground?
A very good morning to you, Desiree. Let us first tell you about where we are this morning before I answer your question. We are at Livingstone Hospital, which has been identified as a vaccine site where the vaccine is going to arrive this afternoon and where it's going to be stored, together with Nelson Mandela Hospital in Mthatha. So those are the two vaccine sites in the Eastern Cape. So this afternoon we'll see the vaccine arriving, and we have heard from the health department spokesperson in the Eastern Cape that possibly at 1 o'clock or between 1 and 2 o'clock we could see the first jabs going out to the healthcare workers. About 200,000 healthcare workers in the Eastern Cape are going to be prioritized in the first phase. In the second phase, then will be other essential workers like people working at post offices, traffic officials, also people working at SASA offices. Then to go back to your question, Desiree, in terms of how do people on the ground feel about the vaccine. 2 weeks ago, a week ago, I interact with residents here, and I could genuinely say that people here are optimistic about the vaccine, especially the Johnson & Johnson one. People are saying that so many people have died because of the COVID-19 pandemic, and if there is a solution called the vaccine, then they are more than willing to actually use it. So generally, I would say, Desiree, people that we talked to, I think about 10 out of, I'll say 15 people were saying, you know what, if the vaccine does come, when it does arrive, I will be the first in line to take it because it will possibly save my life from dying from such a deadly pandemic.
And do we know what sort of preparations are being made logistically in terms of awaiting the arrival of the vaccine?
I am aware that currently inside the hospital there is a place that's been set aside to actually receive the vaccine. They've got state-of-the-art equipment inside this hospital, and also one in Mthatha to also cater to the vaccine. So in terms of the technical side of the vaccine, this hospital is one of the best hospitals we have in the Eastern Cape, and it was also a quarantine hospital. So in terms of technology, it has all the vaccine will need to keep it stored and in good condition so that it can be in a good condition when people get vaccinated. So technically and also logistically, this hospital is ready right now to receive the vaccine, and inside people are working to ensure that the vaccine is kept in a good condition so that it's ready for people to be vaccinated.
On a different note, Lerato, we know that there has been conversation around calls for the dismissal of the health MEC in the province. Is this disrupting the work of rolling out solutions to COVID-19, or is business going on as usual?
Absolutely not. I think that the COVID-19 pandemic, the numbers, although the infection numbers are decreasing, but the death rate is going up. I think the fight is still on. Yes, there are talks on the ground, there are talks politically about the dismissal of the MEC of Health, Cindy Swagomba, and it is something that has been also in the media and also talked about a lot. But I think in terms of what's really important now is to get the vaccine out, because whether she's dismissed or not, the COVID pandemic will still be there. So people are saying, yes, perhaps there are calls to dismiss her for various reasons. But more than anything else, let's get the vaccine to people. Let's try and save lives, because whether she's there or not, lives still need to be saved.
Thank you so much for that update, Lerato Fekisi, coming to us from the Livingstone Hospital. As she says, from the Eastern Cape, no doubt we'll be talking to different provinces about their state of readiness in terms of the rollout of the vaccine.